If you are over 55 and drinking a glass of wine, whiskey, or brandy at night to help you sleep, then every night a chain reaction is beginning inside your body that, a few hours after everything seems calm, puts your heart and brain in extreme danger. I am Dr. Edward, a senior interventional cardiologist, and for the past 22 years, I have seen in the operating theater everything that can happen to the human cardiovascular system between 2 and 4 a.m. In this video, I will explain the entire physiology to you step by step, something most people have never seriously thought about. And even more importantly, I will give you an evening routine that has been clinically tested and has the capacity to reduce your nighttime risk immediately. Let us begin with alcohol's double-edged mechanism. As soon as ethanol enters your bloodstream, the first thing it does is slightly dampen sympathetic outflow and dilate the blood vessels in your skin. You feel as though your tension has decreased, you experience warmth, and your blood pressure may temporarily fall. But this is the false promise behind which the real danger is hidden. While you are asleep, your liver begins metabolizing ethanol, first producing acetaldehyde and then acetate. Acetaldehyde is a toxic intermediate, and its presence triggers a powerful release of stress hormones, catecholamines, adrenaline, and noradrenaline. During the second half of the night, especially between 2 and 4 a.m., this catecholamine surge reaches its peak at exactly the time when a healthy body's blood pressure should be at its lowest point. The effect of this rebound falls directly on your aging arteries. Where endothelial dysfunction already exists, this sympathetic storm can raise blood pressure by 30 to 40 millimeters of mercury. If there is a soft, vulnerable plaque in a coronary artery, this pressure spike can physically crack it. Platelets gather at that site, a clot forms, and a complete heart attack occurs in the silence of the night without any warning. If the same type of plaque ruptures in the cerebral circulation, an ischemic stroke occurs. Both of these events happen while you are in deep sedation, and your response time is 0. Now I come to the second mechanism, which we know as holiday heart syndrome. Alcohol unevenly shortens the effective refractory period of the atrial muscle. Because of this, electrical re-entry circuits can form, and a perfectly normal heart rhythm can suddenly convert into atrial fibrillation, and this can happen even with a moderate amount of alcohol, especially if the patient's left atrium is already slightly dilated, which is common because of age-related diastolic dysfunction. As soon as atrial fibrillation begins, blood stasis starts developing in the left atrial appendage. A clot can form there, which may embolize towards the brain within the next few hours. This is even more dangerous at night because, while you are in a sedated state, you may not feel the palpitations or irregular heartbeat at all. Many weekend morning strokes seen in emergency rooms are caused by this kind of episode during the night. The third mechanism is alcohol's direct attack on sleep-disordered breathing. If you snore, wake up feeling exhausted, and have a dry mouth, there is a strong possibility that you have obstructive sleep apnea, a condition that affects approximately 30 to 40% of the population over 60 but often remains undiagnosed. Alcohol causes severe relaxation of the laryngeal abductors, increases the tendency of the airway to collapse, and, most dangerously, suppresses the brain's arousal threshold. This means that even when oxygen saturation falls below 80% during an apnoic episode, your brain still does not bring you into lighter sleep. This repeated hypoxia activates the sympathetic nervous system every time, increases pulmonary artery pressure, and strains the right ventricle. This cycle can occur 30, 40, or 50 times during the night, each time accompanied by a spike in blood pressure, without you even realizing it. The fourth risk factor is hypovolemia and hemoconcentration. Ethanol blocks the release of vasopressin, also known as antidiuretic hormone, from the posterior lobe of the pituitary gland. This directly means that throughout the night, your kidneys are producing excessive urine while you remain lying motionless. By morning, blood volume is slightly reduced and blood viscosity has increased. Thicker blood, combined with slow flow inside already narrowed arteries, increases the likelihood of clot formation several times over. If you already have atherosclerosis and are in a dehydrated state at night, this combination creates the perfect setting for a silent thrombotic stroke. Now the question is, what should you do? The first and strongest step is to shift your wind-down ritual to a non-alcoholic chemical. Finish your evening meal by 7 p.m. so that the digestive load is reduced before sleep. Then, at 8:45 p.m., take a 10-minute warm shower. This causes cutaneous vasodilation, and as soon as you step out, your core body temperature drops because of rapid cooling. This thermal dip is the natural physiological trigger for sleep onset, and you will not need any sedative. After that, set your bedroom temperature between 18 and 22 degrees Celsius. This is the thermally neutral zone where your peripheral blood vessels remain relaxed, your blood pressure stays stable, and your deep sleep architecture is protected. Make sure to keep a glass of plain water on your bedside table. If you have to wake up during the night, your hydration will be maintained. If you or your partner has ever noticed that your snoring is heavy during sleep or that your breathing stops for a few seconds, then a sleep study is non-negotiable. It can double your cardiovascular protection. Continuous positive airway pressure therapy, CPAP, eliminates apnoic episodes, prevents nocturnal sympathetic surges, and significantly reduces the recurrence rate of atrial fibrillation. There is another clinical nuance that most people do not know. If you are taking antihypertensive pills, discuss evening dosing with your physician. Landmark research such as the hydrochronotherapy trial has confirmed that taking blood pressure medication at night provides better control of sleep-time blood pressure and may reduce the risk of long-term cardiovascular events. The difference in timing is not based on trial and error. It is an evidence-based decision. I am Dr. Edward, and I want to tell you something directly from my 22 years of medical practice. In the darkness of the night, your heart is vulnerable, and a moderate drink that you may consider harmless can turn that vulnerability into an aggressive crisis. This is not meant to frighten you, but to alert you. If you apply the information I have just given you to your evening routine, you are giving your arteries the recovery window they biologically deserve. Finishing dinner early, taking a warm shower without alcohol, maintaining an optimal bedroom temperature, staying hydrated, and taking snoring seriously, none of this is a difficult regimen. It is simply a logical response to the signals your body has been giving you for years. If any of this is connected to the timing of your medication, do not forget to review it with your doctor. This is general education, not individual medical advice. But reducing your risk factors can begin tonight, and it does not require a major change, only one committed decision. Good night. Give your heart the quiet, uninterrupted sleep it deserves.